Alexa TV presents in 3, 2, 1, Dateline Schools with your host, Terry Harrington.
This year, nearly 200 Americans have been stricken with the measles, a disease that can be controlled through vaccines. Childhood vaccines is our topic all this week on Dateline Schools, and to provide some key information and advice, my special guest is the nursing supervisor at the Clair County Health Department, Margaret Sturgis. And Margaret, how serious of a problem is this nationwide measles outbreak that we've seen the last couple of months?
Well, it's actually very serious. Measles is a highly contagious disease, so anybody who does not have protection runs the risk of getting the measles disease, and then they run the risk of exposing others who may not have been able to get vaccinated, either because they're too young or they have a health condition that does not allow them to be vaccinated. This disease has been very serious. 1 in 4 people have had to have been hospitalized, and measles itself is a very serious disease for children. Out of 1,000 children that come down with measles, 1 to 2 of those kids will die even with the best medical care.
And it seems to me it's not just children, but the adults that are getting it too.
Right. In this outbreak, they've noticed that there have been more adults than normal in past measles outbreaks. And that could be for a few reasons. First of all, most kids have the MMR vaccine, which prevents against measles, mumps, and rubella. And secondly, a lot of adults don't have that because the vaccine was not licensed till 1963, so people may not even be aware, adults, that they don't have any protection at all. And then the third reason is more adults than kids tend to travel overseas, and overseas is where we have a lot of measles cases, and those adults are bringing those cases back to the U.S.
You also mentioned that this is we didn't have the vaccine till the early 60s. If today's adult had measles back when they were a kid, will they be susceptible again or a carrier of it?
Well, it's the CDC states that if a person was born before January 1st, 1957, it is assumed that they did have measles disease and they have lifetime immunity.
We'll be back with more tomorrow. For Dateline Schools, I'm Terry Harrington.